Good day, viewers. You're welcome to another edition of Sight Ed. Sight Ed is an educational program designed to entertain and to educate every one of us on issues related to eye health. Our joint business is preserving vision and restoring sight. Today, we also going to be looking at low vision. Low vision aspect of eye care is important to every one of us because there are some certain diseases that we might not be able to restore vision fully, but we want to be able to enhance the remaining vision so that individuals affected can live a normal or close to normal functional life. All right, to do justice to this topic today, we've also gone to interview an expert in the provision of low vision. Our guest today that we interviewed is Professor Folashade Akinshola. I'm sure you're going to learn a lot by the time you listen to the interview. And we hope that many of the things we're learning at this program, you can be of help to tell other people in your environment, in your family, so that everyone can be a beneficiary of this program. And of course, we're going to go on in the second aspect to also continue watching that film on You Are My Eye. That film, it's a film on cataract and it's basically set out to enlighten and educate us in plain language all we need to know about cataract, its effect on our lives, and how we need to take care if someone has cataract. So enjoy yourself. And please don't forget, we keep expecting, as you've been doing, questions, comments, interactions on all our social media. And thank you for sending your questions and comment, and we'll keep responding to them as much as possible.
My name is Folashade Akinshola. I'm a consultant ophthalmologist with the Lagos University Teaching Hospital and a professor of ophthalmology with the College of Medicine, University of Lagos, University of First Choice, and the nation's pride. Low vision can be explained, not quite defined, to say that individual who naturally cannot move about by themselves or read, as it were, when they hold reading materials, they can be categorized as people with low vision. And if we can stretch it a little bit further, they are in the category of where glasses can readily not help them. As long as we advance in age and we get to old age, we have many people with low vision. Some people are blessed because they can still see even when they advance to the age of 80, 90, but with the aid of glasses. But there are some that even with glasses, the natural or the recommended glasses, they cannot see. And we can say these are the aged, those who are really elderly. And it can start as early as from the age of 60, and depending on the type of conditions or eye disorders they suffer from. I'll mention some of these eye diseases, which I'm sure some of my colleagues have enumerated upon. First of all, the commonest is cataract, and it is either called cowrie of the eye or whitish speck in the eye, which is observed when you are advancing age or when you have other systemic conditions of the body like diabetes, and even injury to the eye may cause cataract. The second one is called glaucoma, and we ophthalmologists actually try to water it down for the masses to say that is it thief for the eye or the hypertension of the eye, where you have increased pressure in the eye. And this one has a characteristic of not being solely due to one factor. It is multifactorial. It runs in families and it can be due even to injury. This condition is much more virulent than cataract, and majority of the people that suffers from it, they end up with low vision because they don't present early. We could also have people with diabetes mellitus suffer from low vision. By the time the complications of the retina set in, when there's bleeding into the eye or the optic nerve, which is the nerve of vision, is affected, they also end up with low vision. We also have conditions which affect the nerve of vision, which we call optic nerve. When this nerve is affected and it becomes white, which we refer to as optic atrophy, the individual also ends up with low vision. We have an area of the eye that is called the macula, and is the most, what you can call, acute area of vision at the back of the eye. Once anything happens to that area, the individual also suffers from low vision. And the conditions that can affect the macula to give us even this condition include the diabetes mellitus, it includes macular edema. Some people who love to gaze into the sun, if they are not protected, the eyes are not well protected, they also end up in macular burn, which also results in low vision. So different conditions that may affect the macula in relation to age too, which we call age-related macular degeneration, can also result in low vision. So we have varieties of conditions that can give you low vision, even in children. If they suffer injury and they have severe affectation of the macula or the optic nerve, they end up with low vision. Not to talk of complications of cataract and glaucoma from the injury, which also can result in low vision. So we have varieties of conditions that can give us low vision. But the one that is very important, because we all pray to live to old age, is those that are related to aging, which you must continuously advise individuals on. That when you are old and you find that your vision is not as sharp as it used to be, then don't give up, because there are ways that we can improve vision in such individuals. We can use what is called low vision aids, which are available in different teaching hospitals, and there are other experts that actually specialize in treating of low vision. There are special glasses that people can wear and can help them to see better when they have low vision. There are other changes that you can do in your surroundings that can make you even at least adapt to that condition that you find yourself, so that you don't give up. Supposing you are in the home, you can make the area brighter with light. Have enough brightness in the home. If that is not helpful, you can change the color of some area to make it brighter, so that individual also can appreciate. Especially for our mothers who work in the kitchen, especially like they want to pick rice or pick beans, we can have different color to actually make their trays, so that they can see the rice and the beans they are picking to be much more prominent. And then you have those who use guide dogs, especially those who have actually kind of progressed to blindness. They can use dogs, they can use sticks, and even at that, they have walking or talking wristwatch that can help them. Different, even what you can call communication gadgets that can be used. We have CCTV that they can use that can magnify letters, and also that can help them to actually read and see better. All these areas of correction are available, but people need to know where they can go for it. And most of the teaching hospitals have ideas, even if they don't know or they don't have the facility, they know where to refer the patient. So patients or the community should not keep quiet. If they have people who are suffering from low vision, they can easily contact the teaching hospital or any hospital around. From there, they can get information on how they can get treated. For individual or patients that have been diagnosed with various eye disorders, they need to be treated first for that condition. And if after that condition, which may include cataract, glaucoma, age-related macular degeneration, you can use diabetic retinopathy, they can now be offered the low vision devices that can help them to see better. But it must be stressed that the conditions must be treated first. Low vision is not the first treatment they will receive. It is after they've been treated for all that conditions that they can now be referred to the low vision expert or specialist to treat them. I'm aware that at least I can say categorically of 4 teaching hospitals that offer these services. And I know at Luther we offer the services. University College Hospital Ibadan, they offer the services. Calabar, University of Calabar Teaching Hospital offer the services. National High Center offer the services. Cannot mention the other hospitals because I don't have that data with me. But those teaching hospitals, they have the services. I will put it at average cost. It's not cheap and it's not very, very expensive. But until you come and you are examined, you know exactly the type of low visual aids that can be prescribed for you. But they can be ordered even if they're not available at those centers. So my advice is individuals with low vision should not condemn themselves to a total life of darkness. There is available treatment, but they need to seek treatment.
Alright, you've heard so much about low vision services, and these services are readily available to everyone who might be in need of them. So we don't have to live in despair if glasses surgery have not been able to give maximum visual rehabilitations, meaning there's always hope. We can always make living meaningful, and that is the major aim of low vision aids. So we do hope that as many that are in need of these services will visit the nearest eye hospital next to them to find out about availability of this service and to avail themselves of this service so that we all can live a meaningful life. Right, that is where we're going to put an end to this segment of Side Ed. I do hope you had a wonderful time learning about how to care for your eyes and the eyes of your loved ones. Once again, I remain your host, Adepojufe on Side Ed. Stay blessed.